Everything you need to know about ADHD. What is ADHD? To learn more, visit www.veganchoicefoods.com to learn more about Dr. Sebi herbs using in his banju for brain support. Attention Deficit Hyperactivity Disorder, ADHD, is a mental health condition that can cause unusual levels of hyperactivity and impulsive behaviors. People with ADHD may also have trouble focusing their attention on a single task or sitting still for long periods of time. ADHD symptoms. A wide range of behaviors are associated with ADHD. Some of the more common ones include having trouble focusing or concentrating on tasks, being forgetful about completing tasks, being easily distracted, having difficulty sitting still, interrupting people while they're talking. Signs and symptoms can be specific to different aspects of ADHD, such as hyperactivity, impulsivity, or difficulty focusing. A person who is experiencing hyperactivity and impulsivity may find it difficult to sit still or remain seated, for example, in class. Have trouble playing or carrying out tasks quietly. Talk excessively. Find it hard to wait their turn. Interrupt others when they're speaking, playing, or carrying out a task. Someone who is having difficulty focusing might make frequent mistakes or miss details when studying or working. Find it hard to maintain focus when listening, reading, or holding a conversation. Have trouble organizing their daily tasks. Lose items frequently. Be easily distracted by small things happening around them. Types of ADHD. To make ADHD diagnoses more consistent, the APA has grouped the condition into 3 categories, or types. These types are predominantly inattentive, predominantly hyperactivity impulsive, and a combination of both. Predominantly inattentive. As the name suggests, people with this type of ADHD have extreme difficulty focusing, finishing tasks, and following instructions. Experts also think that many children with the inattentive type of ADHD may not receive a proper diagnosis because they don't tend to disrupt the classroom. Research trusted source suggests this is more common among girls with ADHD. Predominantly hyperactive impulsive type. People with this type of ADHD primarily show hyperactive and impulsive behavior. This can include fidgeting, interrupting people while they're talking, not being able to wait their turn. Although inattention is less of a concern with this type of ADHD, people with predominantly hyperactive impulsive ADHD may still find it difficult to focus on tasks. Combined hyperactive impulsive and inattentive type. This is the most common type of ADHD. People with this combined type of ADHD display both inattentive and hyperactive symptoms. These include an inability to pay attention, a tendency toward impulsiveness, and above-average levels of activity and energy. The type of ADHD you or your child has will determine how it's treated. The type you have can change over time, so your treatment may change, too. Learn more about the 3 types of ADHD. What causes ADHD? Despite how common ADHD is, doctors and researchers still aren't sure what causes the condition. It's believed to have neurological origins. Genetics may also play a role. Research trusted source suggests that a reduction in dopamine is a factor in ADHD. Dopamine is a chemical in the brain that helps move signals from one nerve to another. It plays a role in triggering emotional responses and movements. Other research trusted source suggests a structural difference in the brain. Findings indicate that people with ADHD have less gray matter volume. Gray matter includes the brain areas that help with speech, self-control, decision-making, muscle control. Researchers are still studying potential causes of ADHD, such as smoking during pregnancy. Find out more about the potential causes and risk factors of ADHD. ADHD diagnosis and testing. There's no single test that can tell if you or your child has ADHD. A 2017 study trusted source highlighted the benefits of a new test to diagnose adult ADHD, but many clinicians believe an ADHD diagnosis can't be made based on one test. To make a diagnosis, a doctor will assess any symptoms you or your child has had over the previous 6 months. Your doctor will likely gather information from teachers or family members and may use checklists and rating scales to review symptoms. They'll also do a physical exam to check for other health problems. Learn more about ADHD rating scales and what they can and cannot do. If you suspect that you or your child has ADHD, talk with a doctor about getting an evaluation. For your child, you can also talk with their school counselor. Schools regularly assess children for conditions that may be affecting their educational performance. For the assessment, provide your doctor or counselor with notes and observations about you or your child's behavior. If they suspect ADHD, they may refer you or your child to an ADHD specialist. Depending on the diagnosis, they may also suggest making an appointment with a psychiatrist or neurologist. ADHD treatment. Treatment for ADHD typically includes behavioral therapies, medication, or both. Types of therapy include psychotherapy or talk therapy. With talk therapy, you or your child will discuss how ADHD affects your life and ways to help you manage it.